crafters and those who are not crafters. I'm doing my face-to-face video just outlining my surgery through how I felt the last couple of weeks up until now, because I feel good and I've been fighting a cold. So here's my disclaimer. I'm a patient. I'm going to give you my point of view on things that I think about and how I feel about things. And I'm not a nurse or a doctor, and I don't want you to take any advice or anything that I say without talking to your doctor first. If you're a PD patient, a peritoneal dialysis or hemodialysis, or thinking about it, or you have kidney disease, or maybe you're trying to help someone else through this process, I just want to share it because of that. So I may show my catheter, the little place where it goes into my stomach, for those of you who want to see what it's like and that kind of thing. So if you're squeamish about hearing anything that I have to say about my surgery, how I'm feeling, or my catheter in general, just don't watch. You can turn it off now, because that's what I'm going to share with you guys. I have restarted this video because I tend to ramble, because I'm not following any kind of a script. I'm just kind of sharing with you as I go. So I'll try to stay on kind of a timeline without making this too long. First of all, surgery went really well, and the only thing I was nervous about was getting my IV. They normally put it in the back of your hand. So when you meet with your doctors and the nurse beforehand, they have you meet with people, and I go through the UW here in Madison. So your clinic or your hospital might be different. When I met with these people, I just told them straight out that was my worry, and that I wanted someone who was really good at that. So skip forward to the day of surgery. I am a person who has had many surgeries, so that part of it being put out and the anesthesia and that type of stuff does not scare me. I was worried about the IV. So back to the hand, they usually put it here. That's really sensitive for me. I don't like it. And she noticed that I had a really big vein right in my elbow, which I've always was told before they couldn't put it there. I never understood why, because my vein there is something I'm used to being stuck in, and it's big and it's available, and it's trying to find one on your hand can sometimes be difficult. So anyway, the lady that came in said that it was totally appropriate. We could put it there, and if they needed to move it back into my hand or wherever, they could do it when I was out. And I want to tell you, having the IV put here was absolutely painless. I didn't even feel a poke, like when you normally would feel a slight poke when you get your blood drawn for labs and things. I felt absolutely nothing. It was a beautiful experience. So I want to let you guys know that if you're a type of person that fights with IVs in your hand, talk to them about putting it here and having it moved when you're out, so that all that pain is something that you can avoid. Next thing is, I went through surgery just fine. I woke up, and I'm the type of person who is affected by anesthesia quite a lot. When I wake up, I get really nauseous and I throw up. So what I remember, because I had my mom there, I woke up in about 2-hour intervals several times. Not supposed to stay that long, but every time I would wake up, I would attempt to just eat a little bit of a cracker, take a little bit of water or juice or something. I think if either it was 7-Up or water, I can't remember. And then I would fall back to sleep after I threw up. So I'm a thrower-upper, and I know a lot of people are affected that way by anesthesia. So I ended up staying longer than I would have. I guess you're supposed to stay, but after I got home, I was fine. Of course, it takes a while for the anesthesia and the drugs that they pump into you for that type of stuff to get out of your system. So once I got home, I was relatively pain-free. I mean, really nothing bothered me. And I started eating, and I felt okay. And you do a lot of sleeping after that. You just kind of sleep it off. And then I stuck with my pain pills, but I really didn't need very many. It wasn't painful afterwards. The only thing that really struck me about that after, and I just want to mention this for other people, if you have general anesthesia like I did, to have your PD catheter put in. And PD means peritoneal dialysis, which is not hemodialysis. Hemodialysis is where they put a fistula in your arm, and they put 2 needles in, and they filter your blood through a machine. If you want to know more about that, I can answer questions, but that's not my mode of dialysis, so I'm not going to know a lot about it. But I do PD. So I haven't started yet, but I will be doing it. So I had a PD catheter put in. So the only thing that, so, okay, let's go back to the fact that I had general anesthesia. You can either have general anesthesia where they knock you out completely, you're totally asleep, and you know, for all that stuff. And then what they do is they do a couple of incisions, and they go in and they blow the abdomen up with air so they can see what they're doing with their laparoscopic procedure, and then they can precisely know where they're putting things. The other way is that they do a local anesthetic, which I guess you don't remember. I'm not really sure. It's kind of a medication where you're awake but you don't remember being awake. That kind of freaks me out, so I didn't go that route. But then they would use kind of an x-ray to look to see where they're putting it, and that's not as accurate in my opinion, so I went with the other route. But anyway, that's just so you know, there's two different choices there, and each surgeon does their own type, so you might want to just ask questions and find out about that. So because of the air that is pumped into your abdomen to make it large enough so that they can see what they're doing and make their placement in the right way, you have air pockets that are left inside of your abdomen after they do the stitching and everything's released, and then you're done with the surgery. And that can cause a lot of pain. My pain happened to be right in my shoulder. It was like everything was being compressed up into my shoulder, and it was really hurting me, and the only thing that I could do was get on my hands and knees in that kind of a position. And so I actually spent part of a day, and I slept most of a night with pillows propped up underneath my stomach so that I could stay in that hands and knees position, and by the next day that had totally dissipated and I was fine. So as far as pain after coming home, that's really all I had. It's miserable when you're in it, but looking back now, it really only lasted that, you know, part of a day and part of a night, so you can get through it. Okay, now we're talking about after the surgery, all the anesthesia is pretty much worn off, and this is the queasy part where some people don't want to hear about it, but because it's all this abdomen stuff that you've had done, now your colon and your bowels are starting to wake up, and they're starting to work more normally, because you get totally blocked and constipated from that pain medication and the anesthesia and everything they've put into your system. So over the next 2 weeks after that, everything starts getting better. But if you need help with that, you would like to get on some Miralax. I've heard other people take Senna, which is a natural type of a pill you can get at Walgreens. I didn't have to take very much, but I did take some Miralax to make sure that, because the more you're compacted in there, the more like gas and the more constipated you are and you have all that stuff going on, the more pain you're going to have. So if you can just keep everything going really well, then it's really, really easy to get through it. The only thing I will say is that once the stitching parts, those two little cuts start healing, you start feeling it because it itches. It doesn't hurt, it itches. And you have, for the first couple of weeks, these, what do you call it? Like 2x2s and 4x4s of gauze that they've put over it, and then these tachoderms they call, which is like this big wide see-through tape that they put over the top of the whole thing because you can't get it wet. So while I'm there, let me tell you, you can't shower for like 3 or 4 weeks afterwards, which I did not realize this, and I didn't realize how difficult it would be. So you kind of want to you could totally do what I did, was half and half, wash the bottom half in the tub and then the top half in the sink, you know, bent over so you can wash your own hair or whatever. And that worked out just fine, but it's a pain in the butt. It really is, to do that for several weeks. So by the time I got several of my dressing changes, and then I got to the point where I could do my own dressing change and take a shower, I was elated. I would have taken a shower 3 times a day if that's what they wanted me to do. I've never been so excited in my life to take a shower. So that was really cool. The crappy part. Alright. Yeah, I was almost at my 10-minute mark, so I had to reset. But, okay, the really crappy part. So the first week you go in and you have a dressing change done by the nurse. which was all good and fine because at that point it's starting, well, okay, let me back up. The first one, when I went in, it wasn't quite fully healed, so you have a little bit of a scab around that little tiny opening where the tube is coming out. And when she first put on the antiseptic, it stung a little bit. Not a big deal. It was only a few seconds worth of stinging, and that was it. Then they do a flush of the catheter to make sure that it's working, and it's a tube that goes into your peritoneum, which is basically where your guts are sitting really low in your abdomen. So what they do is they put this glucose, like liquidy stuff, through the tube using like a syringe, like you would get a shot, only there's no needle on it because they put it into the end of the tube. They push in the liquid, which goes into your abdomen, and that I felt nothing. It was when they started pulling the liquid back out that I had this intense circular burning electrocution. I don't know how to explain it. It was the most excruciating pain I've ever felt. It felt like somebody had reached up with a hot something and tried to pull my insides out, but only on the very, very bottom of my abdomen. I don't know how else to explain it, but it petrified me. Of course, she immediately stopped the pull, which was great because I had a sensation for just a few seconds longer, and then it was gone. But it was enough to scare the living daylights out of me, so I did not want to go back the next week. And in this interim of this week, until I waited for the next one, was like a living hell for me. Everything that I'd been in denial of, or not thinking about, or not realizing that kidney disease is actually something you could die from. That dialysis is just a treatment, it's not a cure, and it just keeps you living longer. The reality that I could actually die from this just descended upon me like crazy for that week, and I was cramping. The only way I can describe it is just severe cramping. I didn't even have periods growing up that were like this the entire week, which they said was not normal, but hello, I that's not something I could make up. I cramped for a week. So those of you who are doing it, just know that you might be crampy afterwards. I mean, they've put something in your abdomen that's foreign, that is not normally there. So the fact that it's touching things on the inside, if you're cramping from that, I mean, yeah, that would make sense. Anyway, I went in for the next week, and I sat down, and my clinic is so awesome. I had two PD home nurses that came out and sat with me and listened to me just spill my guts about how petrified I was about having the next flush and how the pain was really scaring me. And the fact that they actually just listened to me and then almost said I wouldn't have to do the flush, but I didn't want to put it off another few weeks because then that fear just escalates the longer you put things off. So that's not a good thing to do either. So I said, no, I really want to go ahead and do it. I just want you to know how scared I am. So I had a different nurse this time around, and she had 2 syringes, and she pushed one syringe in, and I felt nothing, of course. And then she pushed most of the next syringe in, and it was when she was pulling it out that I felt like I was zapped. It was a different pain than the first time, but my body jumped, and my hand came down and smacked the chair, and it was just instant. And I was like, oh, I'm so sorry. And she's like, no, it's fine. And she stopped it immediately. And then she started pulling it again, just a little bit more, and I got zapped again, and my whole body just went. It was like being electrocuted, only on the inside of, like, where your private parts are, like in that lower part of your abdomen, like, scared me. But it was a lot different and less painful than the first time. Good golly. Wow. Okay, so I made it through the first 2 weeks. That was the second flush, they call it. And then we come up to this last week, which I just want to say I'm totally elated. I don't know if this will happen to everyone, but this is how it happened for me. Thursday before my appointment on Friday for my 3rd flush, I went to my regular doctor and I said, look, this is really getting to me. I've been depressed. I've been upset. I've had this whole week of just dealing with all these feelings that are coming up inside of me, and I said I really need something to calm me down for the next time I go in for an appointment, and maybe for the next couple of sessions of dialysis once I start training, so I'm not freaking out, because I need to handle this. And all this stuff that I've been sharing the last 5 minutes in this video is because I want you to know that it's normal to be afraid of this kind of thing. This is not something I was born knowing that I would have dialysis someday and I would totally handle it and everything would be okie dokie fine. No, you have all these emotions you have to dredge up and work through and realize and come to terms with and then accept at some point. And I want to say, it took me, I went through all the emotions in that week of depression and anger and all this crazy stuff. But this third, I'm coming back to it, my point, this third time I went in, I had a lorazepam, so I took that. That was from my doctor on Thursday that I got to calm me down. And I went in and I talked to my doctor and I talked to the nurse, and I had an appointment set up to talk to someone else in clinic, the same clinic as me that's doing PD, so I could ask all the questions I wanted of him and how things were going for him and anything that came up that I wanted to discuss. And then I had my flush. So she did 2 smaller syringes and she pushed one in and pushed the other one in, and I felt nothing. And then she pulled it out almost to the full. She only took one out and I felt nothing. I was elated. She's like, we're done. Well, we're done with that. Just matter of factly. And I'm like, we're done with that? Really? Yay. It was so awesome. So I kind of came back down. It's like this roller coaster you're on. 1 week you're just seriously, you just want it to be over. You just don't want to deal with it. You wish you had someone else's life, and then the next week you have a really good experience, and all of a sudden you're like, oh, okay, everything, this is okay. I can do this. Now I'm still afraid that this pain is going to come back up, because all the people I've talked to that have done PD have said they've had that pain either for the first month, the first 2 months. They were fine for 6 months, and then all of a sudden it started hurting. All these different stories, but every single one of them had the pain at some point. So I'm not happy with those people that tell you, oh, PD is completely painless and it should be painless and no one should ever have pain, because I think that's a bunch of malarkey, and I don't think that's correct. At least not from what I've observed and what my experience has been. Okay, so I should probably wrap this up now. This last week, right before I went in for my third one, which was on a Friday, the Friday before, I got a sore throat and a fever and an earache, and I still have it. The fever's gone, but the sore throat and the earache, and I don't know if that's just because I had the surgery and now my body's immune system is just a little bit that much lower and I'm not fighting it as well as I usually do. I don't know, but it usually comes on at night. I'm okay during the day. Right now I seem really good and I seem fine and my voice is back to normal. It usually happens, when you have a cold, you come down from working all day and doing whatever you're doing, and then in the evening it all comes settling back in, and then the throat starts hurting and the ear starts hurting again. So that's what I'm dealing with now. But it's Thanksgiving and we're gonna travel up north and we're gonna see our family, and my biggest pain in the butt right now, because I have the PD tube. I'm not on dialysis yet. I'll get to that. I have to bring all my supplies with me. I have to bring this special solution that smells like chlorine to wipe off my tube, and I have to bring all my 2x2s and my 4x4s and my tape and my, what is it? I don't know, antiseptic, whatever, medication that I rub on my spot and whatever. And then I have to take a shower every day and make sure that I clean it off, blah, blah, blah. And then I have to make sure that I have some way to hold my tube up while I'm showering. And so I have to make sure that I just bring all that stuff, which to some people, you're like, well, I have kids, so bringing extra stuff is not a big deal. But this is new to me. So my feeling is, oh crap, it's one more thing I have to deal with. So eventually that'll become normal too. And eventually I have to be honest, every day, my obsession is, where's my tube? Oh, I can totally feel that tube hitting that little hole where it's coming out of my stomach, and oh, I can't sit like this, or I can't sit like that, or I'm sitting in class and all of a sudden my tube starts like bothering me, like it's starting to irritate me or hurt me, and I can't like move and adjust the tube because I'm in the middle of class and I'm interpreting and that's my job. And it's like this 24/7 obsession about where's my tube. And I think that's just something that we have to get through and get over, because I can tell today is like one of my best days because it's so much more healed that I now no longer have to tape the tube down to keep it from, you know, swinging back and forth or whatever. It's just becoming a little bit more, not comfortable, but like I'm not noticing it as much. But yeah, I'm still noticing it. I still sit different. I still worry about, you know, what it's a lot more fun to just sit in front of the television and just let it all hang out and just, you know, keep my body laying flat so that I don't bump that tube and just pretend I'm normal for a few hours. And I'm sure that other people are doing that too, but it is getting better. I have to admit that. I'm waiting for the day when I can just go about my business and the tube is just another part of me and I don't even notice it. It just feels normal to me. That's what I'm shooting for. Oh, okay, so what else did I want to tell you guys? Okay, the tube is about as long as my arm, approximately, and I wear a belt to keep it from, you know, falling down or dangling or getting tugged on. Excuse me, and I'm hoping to get a better belt for that. And then I know once it's healed, I can let it hang when I take a shower, because it won't be like pulling on that sore, you know, because it'll be healed more. But there are special things where I can take the tube and hook it up around a necklace around my neck so that it's not dangling and I can take an appropriate shower and that kind of thing. And I'm willing to answer any questions you might have about PD, peritoneal dialysis, and all that stuff. And let me tell you, the reason why I have not started was because the clinic that I was at before my insurance changed pushed hemodialysis and getting your catheter right now. Hurry up, do it. You should have had it done yesterday. We have waiting lists, blah, blah, blah. I was not ready. I don't think you should do it until you're ready, but I don't think that you should wait until you're so sick and so symptomatic that you're so down physically that you can't handle the surgery and whatever. So, do I wish I would have waited longer to put my PD catheter in? Yes, because I don't think I'm to that point yet. But do I regret having it put in? Not really, because if I waited until I was so sick that I absolutely needed it, then it would have been a really way rougher time, I think. Way rougher time. So I have my PD catheter in, but I still have 13% function. I lose approximately, depending on whether I don't get sick, about 1% a year. So I could wait probably another year before I become so extremely symptomatic I need to start it. But I'm thinking the clinic will probably not let me wait that long. So I'll have it flushed, you know, that little flush where the fluid goes in and then they take some out. I'll probably have that done every 2 weeks or every once a month to make sure my catheter doesn't stop working until I start my dialysis. This is a unique position. Most of the time people have their PD catheter put in by surgery, and then they start the week after they're done. They start immediately putting more fluid in and starting to train you, like not before you're even fully healed, which I'm so thankful that I don't have to do, because I think that's where a lot of the pain comes from. The more you're healed and the longer you can have your catheter before you start, I think you're way better off. But that's my personal opinion. So, any questions that you have? I know this was a long video, but I wanted to get it all out there before Thanksgiving and the holidays and stuff, and while I was feeling good and had a day to do it. I would love to answer any of your questions. Just let me know what you have, put them in the comments underneath, and I'll see you next video. Okay, so this next part of the video is my actual site, S-I-T-E site, where the tube comes out of my abdomen, and I'll show you a little bit of what the tube looks like and how I put it into the belt when I wear it. And one thing I do want to say, which they did not tell me, the end of the tube where I tuck it into the belt at the very end, there's a little bit of some kind of an iodine solution in the end. It looks like dried blood or something disgusting, which I didn't know what it was, but all it is just an antiseptic iodine in the end of the tube to make sure that it stays clean and sterile and that nothing gets into my peritoneum and gives me an infection. So I thought I would point that out. And if you don't want to see what the site looks like or the tube, then you can turn off the video now.